Welcome to Phoenix Rising with Dr. Z. This podcast is all about conversations about healing and rising from the ashes of your grief and trauma. I'm your host, Dr. Christina Zampitella. It is my sincere hope that this podcast is going to give you the words and the understanding to help you heal through your grief and trauma. The life I had, I have to grieve the life I had.
Absolutely.
And all the things I used to do. So I know I'm kind of jumping the gun here because I do want to talk about caregivers too, but I'm also aware that I could have you here for 3 hours and that wouldn't be fair. But can we talk about the grief of chronic illness?
Yeah. So I think this kind of ties into your last question as well. So think about, MS or other debilitating, but what's the word I'm looking for? You had a menopause moment earlier. I'm having one now. Declining, but that's not the right word. Progressive diseases. So if we think about progressive diseases, you might have been that active person that ran and did marathons and now you can't. So there's a loss of your activities, or maybe there's also a loss of family and how people interact with you and relationships. So I think there's so many secondary losses that occur as a result of illness. And I think allowing people to acknowledge, what have we lost? Is it something that we can regain? Do we want to? Maybe those were unhealthy relationships. So I think identifying the losses is really important too. People tend to, around chronic illness, especially if it's sudden, right? A sudden onset. From what I've said, this is anecdotal, right? Based on my clients and my personal life and other things, but it's anecdotal. I feel like, and this has been validated by many of my clients, people are there in the same way that people are there right after a funeral. They're there for a certain period of time. They will ask you how you're doing for a certain period of time. And then people fade off when it doesn't seem as salient to them, but you're still living with this chronic illness or the effects of the illness or the changes. So I think there's loss of relationships and support. Is it something you want to bring back into your life?
There could be even loss of, I wonder, like a sense that your body has betrayed you. And like, what if you wanted to have a family? And now you can't have a family because your body can't do it. And by the way, if you go through chemo, it'll kill off all your eggs and you'll go into menopause. Nobody tells you this. So again,
that's not true for all chemos, but for many of them. Yeah.
For many of them. Yeah. Sorry, but thank you for clarifying that. Let's scare the shit out of everybody. Sorry about that, guys. But the way that our bodies have changed, like you said, people might be there at the beginning, like they are, oh my God, I can't believe you got this diagnosis. And then life goes on for them. Yeah, life's going on for you too. And life's not only going on for you too, but it's not so great. And it does not look like there's potentially going to be like a cure. There might be not treatment, but what is that called?
Palliative?
Yeah, more palliative, kinds of care, or also like managing the symptoms, like an ongoing, knowing that you're going to be managing the symptoms, but that doesn't mean that this is necessarily going to go away as far as you know right now, right? So okay, and then I'm going to bring into caregiver. Do you have the time for this for me to talk about caregivers? And I know that you're really
we can talk
to this part. Okay.
Well, before we get there, I think there's so many other losses we're jumping over, right?
We are. Go ahead.
There's like the loss of the future and plans and job loss is so common with chronic illness, right?
Thank you for bringing that up.
There's There are resources to help you with that, but it doesn't mean that you can't still grieve the fact that you enjoyed your work or you can't do it. I've talked to many women or even their partners who, like you said, they either had to preserve their fertility, and you have like 30 seconds. It's an exaggeration, but you have 30 seconds to decide if you're going to have your eggs retrieved. And then the cost, apparently, to get those eggs back isn't always covered by the insurance. So there's a cost associated. Sometimes it is. I've had women who have had their eggs frozen and then the freezer died at the storage facility. So now you have loss of fertility in a different way. I know several of my clients and friends who were pregnant when they found out they had cancer, and those were wanted pregnancies and they had to have an abortion. Right. So
Oh
there's
my God.
layers and layers of loss that can come that we're not even aware of. And allowing yourself to find the support and the grief. But for someone I know that had that experience happen, she couldn't go to baby loss support groups, and she couldn't go to, cancer support groups. She didn't feel like she was straddling this, like, where do I belong and how do I get the support? So these are complicated losses, whether they're death loss or non-death loss. And how do we find that support? Like, who can I feel comfortable sharing these deep, dark things with? And therapy is great and I highly recommend it. But also, how do you find those personal supports that will understand and listen and validate you?
It's like we want a community because obviously therapy can be fantastic, but being with a group of people who can relate to what you're going through, and you can say all the things that other people are going to go, oh my God, yes, it's exactly, yes. I've experienced that too. So how do we do that? How do we?
Yeah, so I think knowing what your illness is, there are plenty of groups out there doing amazing work. For example, actually I'm pointing like you can see, but a couple buildings up from me it's a national headquarters of the Young Adult Survivors United group. They work with young adult cancer patients and their caregivers. Great organization, doing amazing things, online, in person, all of it. But they have such a niche, right? Young adult cancer patients. But, and then there are for MS, you just have to find the right organization to point you in the right direction. And whether it's peer supported or professionally supported, I think can make a difference. Some people prefer one over the other. But I think there's certainly ways to find the resources and supports, but I also think finding your individual supports that knew you before matters. If we go back to that idea of identity, like someone that knows you.
Yeah. So then I guess that can weave us into your caregiving, right?
Yes. I'll stop avoiding that.
Found you. Boy, that was pretty shitty.
It's okay.
So finding those people who knew you before, and sometimes perhaps it's your spouse or your partner or a parent or a child, that, become the caregiver. And so the relationship dynamics obviously shift. Would you be willing, and only to the level at which you are comfortable, share what that process was like for you, from going from wife and partner to caregiver, and the difficulties or struggles or successes and wins, what that's been like for you?
Yes. So let me state that it was going from fiance to caregiver, because on our honeymoon is when he found these bone chips coming out of his gums.
Gotcha. I can't even imagine what that was like.
We were in Phoenix. It was great. apparently that also had been happening for about a week or two before that. He just didn't tell me because he didn't want to ruin the wedding. I was like, you couldn't have waited another week. No, I'm kidding. But in that way, like I was his caregiver through way too many surgeries and hospitalizations to count. Like I said, literally every semester in the master's and doc program. And then fortunately not while I was on internship, but, and many since then. So I think going from that, even that space of how do I love and support my husband, be his advocate, and the grief that comes with knowing that he and his health, and he's told me before that he doesn't think his life expectancy is that long because of things the doctors have said. What that long means, who knows? I mean, I'm 50 and he's 52. We're exactly 18 months apart. If that's 65, like that's not that long. Like, are we? Yeah, and this is my second marriage. Are we gonna have a 50-year wedding anniversary? Probably not. I mean, we would be old as it is since it's a second marriage, but what do those milestones look like? I think one of the biggest adjustments for me as his caregiver with someone on a feeding tube has been, I love to cook. I think I'm a pretty good Italian cook. I don't buy sauce in a jar, and I try to make pasta from scratch when I have time.
Because it's gravy, it's not sauce, but okay, go ahead. I hear you.
My dad's from Italy itself, so it's
gravy.
It's actually ragu. No,
it's ragu.
or sauce. It's not gravy. But
my family, for some reason, they called it gravy. But go ahead. You're first.
We're in Pittsburgh, not Jersey. No shade. That's what we call it. Sauce. So anyway, and he loved food, right? We had some great meals and memories together. So that has been a huge loss. You don't realize how much everything surrounds food until you or your partner cannot eat.
Date nights. Right? Date nights. Let's go out to dinner and do blah, blah, blah.
Right. Which he's fine. Mm-hmm. Let's go out to dinner, get you something to eat, and he'll have his food in like the car in the feeding tube. But then he's like staring at you eat. It's really super uncomfortable. Mm-hmm. We're working through that. So that has been a huge loss. But this idea of the future, like what does that look like for me? And given my own past and trauma, I shut down. Like I'm talking about these things, even when I met you a month or a couple of months ago, right? I was sharing with you other things that had happened in my life, and I didn't probably shed a tear because I cried when my brother died, but, and I cry when I talk about that, but for a lot of other reasons, I shut down, and it's an effort to not do that as a caregiver with my husband, to share.
So you shut down or not shut down?
To not shut down, to be vulnerable, to understand how this has impacted me and not make it about me, right? I'm his caregiver. My experience is also valid, but I don't want it to be about me.
What would happen if you allowed it to be about you? Oh, look at your face. You can cuss me out later. What would happen?
I mean, that feels selfish to me. And I know self-care is not selfish. Literally studied caregiver distress for cancer caregivers, mind you, before I was a cancer caregiver, in my dissertation. So, I mean, sure, I was taking care of his other things, but I was not a cancer caregiver. Side note is that I did call my dissertation chair when he was diagnosed for the third time and said, "You should probably take back my doctorate, because I don't think that was a very good good findings. It's not applicable."
Looking back and like conceptually, yeah.
I think the moments that I let myself feel this, I'm alone, right? Because that feels safe. Like, then people aren't judging me for either decisions I've made around his caregiving or being selfish and not. I think there's a perception sometimes for caregivers that you have to put everything aside for your loved one, where we know, and I know the research says that caregivers' health, their physical health, is often impacted by their caregiving, because we are not going to take care of our own appointments. We're not. We'll wait. We'll do that later. We have to focus on the caregiver, the person we're caring for.
So it sounds like it's like, I don't feel like there's really room for me, and I don't have permission by myself or maybe even other people to have room for me. On the other hand, how do you do that for those people listening who are caregivers that are like, you know what? I hear you. That is exactly what's happening to me. And I know that that's not good. So what do I do?
So caregiver support groups, I've run them.
Okay.
Those are helpful. But I think, again, to plug therapy, that can be helpful. Find somebody that understands that your caregiving doesn't have to be the only thing in your life, right? There's the Caregiver Bill of Rights, which I don't know if you're familiar with. If you Google it, it does come up in a couple places. The Alzheimer's Association has a printable version of that, and it's great. It reminds you that you have the right to care for yourself, the right to stand up, do all of the things. I don't remember all of what's in there. And then there's a blank line at the bottom for you to fill in. What do you have the right to do?
So what did you put in your line?
That. Probably ask for help, or I don't know. It's been a while since I actually went through that exercise. Okay. I also would encourage caregivers, because what really becomes hard is in those moments when you're sending out the 6,000 text messages to update on whether it's a surgery or how somebody's doing, or the emails. There are ways to do that are less stressful, such as, I think it's Caring Bridge. There's some apps out there. I can send them to you.
Yeah, please.
That can help you do that. But ask somebody to help you with that. Also, if you don't give an update today or ever, that's okay too, right? Having conversations with the person that you're caring for is extremely important. A lot of times, and I see this in my work, but I saw it in my personal life too. The dyad of caregiver and patient will often not share how they're feeling about the situation or one another, because they don't want to burden the other person. Caregiver burden's a real thing. You feel like, this is hard. This is hard work. Like, did I want to have to decide that to put my husband in a facility? No, but I knew. And he and I have had disagreements over this decision that I made, but I had to decide if I was going to take him home with a trach and try to clean and navigate the trach. But the reason I decided to put him in a rehab facility when he could barely speak with a trach was I didn't trust that I could do that well. What if I had to leave at the time my child was, I think, in elementary school? What would I, middle school, I don't remember. What would I do if I had to leave the house and he aspirated, or the trach needed care and he wasn't able to do it? Like I was afraid of the outcome. So I made the decision to put him in a rehab facility with very little information on the actual rehab facility, because the social workers handed me like 20 pages of places I could choose from, and I chose poorly. And so then I had a lot of guilt over that too, because it wasn't a great facility. And once they're in there, it's really hard to like, you can't really switch with insurance. And there was another time that he had a surgery that wasn't the cancer surgery that I was a brownie troop leader. I was probably a terrible brownie troop leader, but he was in the hospital for 2 weeks. He was in the hospital. He was safe. Like he was, whenever I took this brownie troop, I didn't change the trip. Like we had a night at the museum, at the history museum, blast, in which he was also getting leeches on his neck at the same time. So we went to the night at the museum at the Pittsburgh History Museum, Heinz History Museum, and they did this. Who knew? He's getting leeches. Funny story. They have these actors that play the characters, so the museum comes to life. And there was a Black physician who developed leeching. That actor played the doctor that created this as a medical intervention. And I'm sitting with a troop of girls and like sobbing, and my child raised their hand and it's like, my stepdad's getting leeches right now. And of course the docent pulled me aside and said, is that true? And I was like, yeah, that's true. But when I told my husband about it, he was really upset that I didn't cancel that event, that I wasn't there with him. It's like I wouldn't have been at the hospital overnight anyway. I would have been home with my child. So there's this guilt and burden, but we didn't talk about it ahead of time at that point. Right? So these conversations are important. Like, how are you feeling? There's a body of research out of Arizona. I think it's the University of Arizona. I forget the researcher's name at this moment, but she looks at the conversations between caregiver and patient. And there is research to support the mortality rate of the patient is higher if the distress of the caregiver is higher, which then adds to that burden. Like I knew this research and I thought, oh gosh, I'm distressed. I can't let him know, because then his mortality rate is higher. But the truth of it is, what actually addresses that is that conversation. Get it out in the open. So neither of us are as distressed, and we can support one another through these things.
Well, and also, okay, so we have to be careful with cause and effect, right?
Right.
So is it...
it's correlational,
yeah,
of course.
Right. And in English, that just means there's a relationship there, but there are dynamics that might be part of that.
I misspoke.
So,
yes.
Right. I'm just putting it in like English because I can barely understand research. So is it because, there's just no communication, or is it because maybe there's resentment built up and maybe there's not communication about what was really needed, and therefore the care isn't there and that kind of thing. So the mortality rate being higher may not be because you're just not talking about it. It's just like the implications and the fallout of not having those conversations.
Absolutely. Right. For sure.
Yeah.
Thank you for the reminder.
I just wanted to
clarification.
I didn't want anybody freaking out and being like, oh my God, I'm not talking. I was like, hold on. There's parts of that are, important to consider.
Right. But I do think that the conversations are important. Right. And so my husband and I have since had conversations like, I'm really afraid of this. And he's shared that he hasn't always shared how he feels about things because he doesn't want to upset me. Like, I'm already upset. You're already upset. We're just not talking about it. So let's talk about it. So those are helpful. If you can't do that, again, have a therapist help you, right? That's what we're here for. We can help facilitate these conversations
How does
in a
somebody
safer
find
place.
somebody who is qualified to help facilitate those conversations? Because not all therapists are. That's pretty specific. So how do they find somebody who does that?
I mean, I think you could find a family therapist, but I would encourage you to find one that is familiar with chronic illness. I mean, I've done that with my patients and their loved ones, right? I'm still working with the individual, but they'll bring in a loved one so we can have these conversations.
So how does a person go about finding a
Finding
therapist?
those.
Or what questions do you ask a therapist? I call you up. Oh, I want you to be my therapist. What questions do I ask?
So, you first share why you're looking for therapy, right? Like, I have this. What is your experience with that? How long have you been doing this? What types of illnesses do you see? I've spent a lot of time talking about cancer today, but if someone asks me, I can tell them all of the other things that I work with. Right? Ask them that. Is it professional work or is it personal knowledge? There's a difference. There are therapists who, because of their own personal experience, will then start treating people with that illness. That doesn't always align. So what is their professional experience with the work that they're doing? How do you approach the idea of healing versus what if this is terminal? I'm sure there's other questions and I'm blanking right now.
What are some things that we can... So we've talked about a lot of the pain, right? And the frustrations, the complications that can occur, the interpersonal dynamics. We could keep going on. Obviously, this is a huge body of knowledge. For those people who are listening or watching and are trying to figure out, okay, I'm hearing all the shit. Oh, that sucks. But what can we bring to the table here that might be helpful, encouraging? I don't want to ignore that the pain is there, but where can the positives be? Like, what's needed? What are good coping skills? How do we know somebody's resilient? Like, what, in other words, if we're saying the person's not like, I'm a person with epilepsy. Okay, well, yeah. So what's the not the good part? Do you know what I'm?
Yeah, like
I'm fumbling
post-traumatic
around here a little
growth.
bit.
Like, how am I resilient? How do I live with this in a way
How
that's
can I have
helpful?
a meaningful life that has happiness in it, and it's just not all completely sucked dry out of like not being able to take care of myself, or wanting to take care of another person as a result I'm not taking care of myself, or our intimate life is impacted, or our ability to go out to dinner, or social, and all the things, all the domains that are impacted. But what can we do in a way that improves quality of life and brings a sense of being able to kind of emerge from this trauma and grief?
Yeah, for sure. So I think this is, I was trained largely as an ACT therapist. I do a little more narrative work now, but I think this is what I will say about that is what's important to you now. Like, what has always been important to you? Has that changed? Like, what do you value? What do you enjoy doing? How can we incorporate even bits of that? So you like being outside. Maybe you liked hiking. Maybe you liked going to the water. How can we bring that into your life now in a way that feels sustainable and doable? You don't have to abandon everything. Not everything is all or nothing. Like, what did you enjoy doing in your life? What has helped you get through this, right? Whether that's faith or spirituality or other people or screaming into the void. Like, how can you incorporate that in a healthy way? Like, what are the coping skills that you already have, and how can we further develop them? What do you like to do? Can you get your mind off of this for even 10 minutes by reading a book or doing the thing that you loved? Can you adapt what you love to fit your life now? Do you see yourself getting back to it? And is that reasonable? I don't know if that answers your question, but
No, I think what I'm hearing you say is, how do we bring in those things that we enjoyed before whatever that chronic illness may have been, or, you know, if you were born with a chronic illness and there were things that you enjoyed and it's become more problematic. How do we bring in as much of that as we can in order to improve the quality of our lives, and without having to say, "Oh, I've got to give all of that up." Um, what what characteristics of an individual will help develop an increased sense of resiliency so that there's a sense of fulfillment and meaning in life as one continues to carry with them these illnesses?
that's a great question. I mean, that's so personal, right? But I think, what is someone's willingness to tolerate the distress of everything? Like, how do we not just dismiss the experience, but accept it and live with it? I think I'm careful to say, because I think your question wants me, the way that I'm wanting to respond to that feels like character traits, and I don't want to demonize character traits, right? So how do we develop resilience? I don't think it's necessarily you have it or you don't.
Oh, I agree. How do we increase resiliency? What are some
Right.
things that we can do?
So what has worked for you? Like, I think surrounding yourself with the right supports is a good start. Acknowledging when it's too much to go forward. Like, this moment keeps coming to mind for me personally. And this is probably where I'll cry, so I'll just try to not look at you.
Okay.
There was a moment in that time when Brian was in the hospital for 2 months. And I think my child was at their father's. And we had this big, beautiful house. It was our dream house. And I knew that might not be the thing that was going to be there forever. And it wasn't. Largely due to those finances around treatment. And I just remember collapsing in the shower. We had this open, that there were these beautiful windows that opened to the backyard and a soaker tub and then a separate shower. And so in the shower, I could see out into this green space. And I'll never forget that I was standing there and I collapsed to the ground and I was just sobbing. My therapist had said to me, she's no longer my therapist because she didn't get grief. But my therapist had said to me, you've been through so much in your life, like a lot of hard things. And she wasn't wrong. She's like, you always pull yourself up. And then she moved on, right? This was supposed to be that point of, you're resilient, you can do this. But I remember just collapsing in the shower and be like, I'm just tired. I'm tired of having to get up again and again and again. And I don't know if he's going to come home and have speech or be able to work or function. I don't know if I'm going to have my husband. He could die. Like, I was sobbing. Like, if he gets cancer again, then what? Like, all of the ifs. And it was this idea, like, I could be resilient. And I think that part of the reason that I'm struggling to answer your question right now is when someone's sitting in front of me, I think I can answer this question. Like, let's explore what makes you resilient. But I think for me, like right now, having this conversation, I'm like, I don't know what made me resilient. I just kept plowing through because I think there was this fear that if I stopped, and perhaps I still live my life this way, texting you at like 10 o'clock at night, telling you I'm working on things. But
As
if I
I'm going, me
stop,
too.
yeah, I was afraid that if I just stopped, I would break. Right. I don't know if that's resilience. Like, I think to my therapist's point, like, oh, you've done this. Like, that means you're resilient. But I don't think it made me resilient. I think it just made me stupid for not asking for help. Like, I just keep going. Like, this is what I have to do. I have to keep supporting my husband and my child and some other terrible things I didn't want to talk about here today. But like, I just kept going. I don't know if that makes me resilient.
I wonder if collapsing in the shower and wondering all of those things and being in that space wasn't in and upon itself a resilient thing too.
The vulnerability.
Yeah.
Right. There is that inverse relationship between vulnerability and resilience. So maybe that is the answer.
Look at
Allow
you getting all
yourself to be,
intellectualized. Yeah. That.
yeah,
All the
avoidance
things.
right now.
Great. It's beautiful. Great. We're great at that. We're great. But in that moment, when you were sitting there in that space, like, could you imagine right now, like, put yourself in that space and see the green and be in the shower and be in the midst of all of that. And remember collapsing in the shower and crying, and to be able to say, because I'm doing this, this is me coping. This is me resilient because I'm giving myself permission to be there.
Yes. Yeah. So that's the answer to your listeners. Yeah. Allow it to be there.
Other things I think of with resilience. So it's boundaries. You mentioned boundaries. You mentioned plowing through, but okay, we'll take that with a grain of salt. As I say, hey, after my brother died, I went right back to school. Okay, that's what we do. But having, I guess, sometimes with resiliency, having routine is important. Self-compassion,
Oh, yes.
huge, right?
Yeah.
You know,
So Darcy Harris, who we both know, she's a researcher and expert on self-compassion. She does, that is a great point, right? How can we be kind and loving and nurturing to ourselves so that we can support others? She actually just said to me at that retreat where you and I met, she said, you cannot be compassionate and caring towards other people unless you are compassionate towards yourself, because there's no possible way to be cruel. Cruel is not the word to use, but be cruel to oneself and give out this compassionate, loving stance with other people. So I do think there is something there, right? Like, how can we find that self-compassion? And there's plenty of resources on that. Kristen Neff's selfcompassion.org is a good place to start.
even learning mindfulness techniques and grounding, that kind of,
which is what I did in the shower,
which
right?
is
Like,
exactly what you did in the shower. Exactly.
So,
I'm just going to keep bringing it back to the shower. Yeah.
Cool.
Going back to the shower, making sure we continue to take care of our own physical well-being as best we can. It doesn't have to be perfect, but to give yourself some grace, I would imagine.
Yeah, absolutely.
It's often a source of resilience. But I also want to say that as a person with chronic illness, to, like you keep saying it with the boundaries, to have boundaries and say, okay, yes, I have that. And I acknowledge that I have that, and I recognize it, and I give myself permission to feel that. But I'm also going to give myself permission to enjoy the things that I can enjoy, whatever that might be. It might be this piece of freaking chocolate cake, or it could be I'm going outside and I'm just putting my feet on the earth. Getting outside is also, I think, helpful with development of resilience as well.
Yeah.
The resilience and being able to express the grief of it with people who can hear you. Without people who can hear you, without that validation in order to heal, there's a saying, it says joy doubled is joy, joy shared is joy doubled, but grief shared is grief halved. Do we have people that can share that grief, in which that maybe we don't want to put that on our caregiver per se? Maybe there's other people we want to try to find. So, having at least another person in your life would be important.
I think one other tidbit is, in that dissertation I mentioned, this was actually one of the findings. It's true. I just argued against it in my own work, or my own life experience. Don't add new things. Like, don't try to start becoming a runner while you're trying to take care of a loved one or navigate your own grief if you're not already a runner. Like, what's already working? Like, you don't have to. You can, but don't take on the big things. Right? Maybe it is learn mindfulness and grounding, because those are acts of self-compassion, but don't feel like you have to do something extraordinary.
So as we kind of wind up, and I know we've had a long interview today, but as we wind up, is there anything parting that you feel like our listeners and viewers should hear?
I think knowing that you're not alone in this journey of chronic illness, whether you're the caregiver or the patient, like, the common humanity of that is important. And when you're interacting with your medical team or your loved one's medical team, validating that for yourself, because they see however many people. This is your life and your experience, and it matters. If they don't see it, advocating for yourself so they do see it is important. I used to teach advanced practice professionals, so like nurse practitioners and physician assistants, about this very thing. They're going into this field, the physicians, all of the staff, because they want to help you. They don't always come off that way because they have to see so many people and manage their care. It's okay to remind them that you are human and that your story matters, so that your humanity is seen by yourself and them. You're not just a number.
You're not just a number. You brought up something. I was going to shut up, but I'm going to share this story because you just kind of like totally triggered me in an interesting way. No, not in a bad way. So triggered's the wrong word. So I'm in the hospital. It's the first 30 days of the leukemia treatment. The guy who's in charge of the oncology department at UPenn is doing rounds. They switch every 2 weeks. He's got his whole, cronies, his group of students that are coming in. And he comes in and he's standing at the end of my bed and he is talking to me and he's like, and blah, 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 and, about this and people like you who, blah, blah, blah. And I was like, whoa. Because no. I said, let me ask you something. What do you mean people like me? And he goes, well, people who like have cancer. And I'm like, oh, so a person who has cancer And he just looked at me like shocked, like literally shocked. And then he's talking a little bit, and then he goes to say, and he stopped himself. And he said, and those of you who are struggling with cancer. And I was like, I just felt like I just won cancer. Like I just won. And I looked at all of the other students. I said this right in front of them. I'm like, I hope you heard that. I hope you heard that. So have a voice is what I'm hearing you say. Find your voice and don't give up.
And it's okay. It's okay to learn how to have your voice, because our medical system isn't easy to have that voice. I had an oncologist say to me once, he said, we had a patient who everybody that worked with her adored, and she was young, and she died. But he said, it's not my job to focus on quality of life. My job is on quantity of life.
Wow.
And he and I had some words over that, because her family really wanted her to have quantity, not quality. And she wanted quality.
Oh,
I know her. Yeah, they
I
wanted
see
her
what
to
you're
live
saying.
a long time.
Oh,
And all she wanted was the quality, regardless of
quality.
the quantity. And, those are important conversations to have with yourself, right? Like, do I want to live at any expense? Or do I want the quality of life? And there's no right answer there. Like, that's a very personal choice. But being able to advocate for that with your family and the medical team and your caregivers, because you might see it differently than your partner or your loved ones. It's okay to say what you want.
Important. Just because they have a white coat on doesn't mean that they're the end all to be all. They are a human being just like you, with their own backgrounds, and don't be afraid to say it. Well, I know I kept you a very long time, but I am so thankful. Well, it's such I keep getting people asking for this topic to be covered. So, we'll break it up into several episodes to make sure that people can really see the whole thing and understanding. We haven't even talked about families and kids and all the other things. There's so much more to it.
I'm happy to talk about that at some point.
Again, I think we'll be picking. We'll pick another day before we end our session today. But thank you for coming on here and for doing the work that you're doing and communicating it, and then putting it in such a way that's going to be digestible for everybody hearing this. I really do feel like this is going to impact a lot of people who need to feel heard and want to know what to say, and how they also can rise from the ashes of what they're even struggling through right now. So just thank you so much. And I really appreciate it.
Thank you for having me on. If I could put one last little recommendation in there.
Sure, please.
There's a book. It's called The Human Side of Cancer. It's by Dr. Jimmy Holland, who I mentioned earlier. I think it's been a while since I read it, but I think it would be helpful even for other chronic illnesses around conversations. She wrote it for her patients. She died a while ago, and it was written in 2000 or 1999. So you have to ignore statistics and numbers, but it is really helpful to think about how to live with a chronic illness.
Okay. So the human side of cancer, and then this caregiver bill of rights sounds like it's really important.
Yeah. Yeah. But thank you. And thank you for all the work you're doing in grief and loss, and all of the wonderful things, and the wonderful human that you are. Oh. You made me feel super comfortable when I met you. And
I'm really glad that you feel that way. Yeah. All right. Well, everyone, keep an eye out for Angela. She's not done, man. She's out there. She's got lots to say, and I know that we'll be seeing her again as well. And I just want to remind everybody that it's through challenge we awaken the power to heal. So thank you so much, and we'll see you next time.
Thanks for listening to Phoenix Rising with Dr. Z. If this episode helped, subscribe and share it with someone who needs it. We'll see you next time.